Hey guys, Dr. Colby Smith here from Midtown Chiropractic in Anchorage, Alaska. And today we're going to be talking about foam rolling for the lower body. We're going to hit those most commonly overstressed, tight areas. Show you how to better get those prepped and ready to go in your warm-up routine. All right, so the first one we're going to get is kind of the lateral leg IT band area, and we can follow that up into the hip. To start off getting in position, I'm just going to kind of get my hip on there, and I like to cross this leg over. I got one hand down, I can put this other hand down, so I've got plenty of contact with the ground, so I'm keeping my balance, we're not falling over. And you can also kind of support yourself to control how much pressure you get on there. Sometimes we can find some really tender and painful trigger points. So I'll straighten out the bottom leg, and then we slowly just kind of roll ourselves down, and I'm working up top from that hip pointer on the side, that's the greater trochanter, and then kind of up to the top of the pelvis, and just kind of back and forth there. You can also rotate yourself forward a little bit more, get a different area, and I can rotate, open up my chest a little bit to get the rest of the area. And then we can just follow that all the way down to the knee, larger sweeping strokes, or I can do just kind of small little ones once we find a spot that we want to work through. And, usually like 30 seconds to, a minute maybe, and then kind of moving on, or until you can't stand it anymore. Okay, then moving on from this position, it's really easy to just kind of rotate over. And so I'm just sitting on there, and I got my glute here, and I can lean back. I've still got my 3 points of contact, and I'm going to roll through the meat of the glute there, back and forth. And then if I want to make that area pop a little bit more, I can cross my ankle, and that actually gets the external rotators, that piriformis group, a little bit easier. And this is a chronic overactive guy, so this one can be a little tender, feeling it now, but this is a good one. And then you can also kind of rotate in this fashion as well. Straighten out the leg, come on down, we can get onto the hamstring, and we're just going to keep working back and forth from the top, the base of the pelvis all the way down behind the knee. Small little movements over tender areas, and then bigger, broader sweeping movements to find them. Move down to the calf, same position, back and forth. With my foot now, I can externally rotate to get more of the lateral aspect of the calf, internal rotate to get the more internal muscle groups there. If I need a little bit more pressure, I can cross my ankles and roll this way too. Move around down, continue down over the Achilles area to the base of the heel. You can sit and just kind of back and forth this way. Same thing if you want to focus into that area. All right. And we can move into, let's start over at the top of the hip. We'll do the quad. And I'm going to place this, I'll go this side so you guys can see it better. And just at the top of the hip here, and I can get down in kind of like a planking position. And I've got my knee on the ground over here also. And we're just going to kind of back and forth. If you've ever done like a plank seesaw, it's kind of the same motion we're doing here. And again, I can rotate my back leg internally or externally rotated to get a little bit more of the front of that thigh. And then just keep working on down. You can come up like this to get a little bit more into it. Change the angle, stay low, whatever's the most comfortable for you. And then inner thigh, we'll do a frog leg. So I'm going to put my leg straight out at 90 degrees. I'm still in that planking position, and I can roll back and forth. And these guys are usually a little tender. You can come all the way up into the groin, out to the knee. And so I'll just play around, find those sweet spots, work them out, about 30 seconds each, or until you can't stand it anymore. So those are the most common areas we work with patients here at the clinic, and hopefully you find those beneficial. For more information, check out our website and look for our foam rolling classes if you want more hands-on help. It's a good resource as well. Thank you for watching. So those are the most common. There you go. There's your outtake.